Welcome. My name is Amy Smith. I'm the Bariatric Program Manager here at Northeast Georgia Medical Center. We have several treatment options for obesity, but today's talk is really going to focus on when dieting alone isn't enough, and we're going to explore nutrition therapy along with one of our dietitians in obesity medicine. Now, in our program, we have several treatment options, including the dietitian, medical weight loss, but we also have an intragastric balloon, which is a non-surgical procedure, and metabolic and bariatric surgery, also known as weight loss surgery. If you are more interested in the intragastric balloon or surgery today, I would invite you to check out our website at nghs.com/bariatric. We do have a free online seminar that you can watch at any time from the comfort of your home if you're interested in that treatment option. So today I am joined by Giselle Cram-Ortiz. She is our bariatric dietitian here in the hospital-based program, and she's going to share with you what a nutrition visit would look like when you're really focused on getting to a healthy weight. I'm also going to be joined by Dr. Christina Nguyen. She is one of our obesity medicine specialists over at NGPG, and she's going to talk to you about what it would be like to go see a physician that specializes in weight loss and what you may expect in that visit. So I'm going to stop sharing my screen here momentarily, and I'm going to turn the talk over to Giselle so that she can cover her portion here.
Hi, thanks Amy for the introduction. I'm going to share my screen here, so just give me a sec so that I can get my PowerPoint ready for you. All right, so can somebody confirm that you are able to see my screen? I just want to make sure that you're able to see it.
I can see it, Giselle.
Okay, excellent. All right, so as Amy said, I'm a registered dietitian here in the hospital-based program, and I'm going to talk a little bit about what it means to go through a weight loss nutrition counseling with me. So I do individual nutrition weight loss counseling. My specialty is in medical nutrition therapy for overweight, the treatment of overweight and obesity, and any other chronic health conditions related to overweight and obesity, such as high blood pressure, diabetes, high cholesterol, and other conditions as well. Now, the difference between the medical nutrition therapy and some of the diet fads that you see around in the internet or you may have heard people doing is that everything that I teach is evidence-based. So I use the latest evidence, nutrition-related evidence, to provide the guidelines for my patients, all right? So I don't try anything. I don't experiment with my patients. This is all evidence-based. I do one-on-one sessions with my patients, but sometimes my patients like to bring a support person into the visit, and that is absolutely fine. I actually even encourage it, because if you have somebody that lives in the house with you and that's your support person, I think it's good to incorporate them in the session so that they can learn about nutrition and they can also learn how to support you with your weight loss goals, because a lot of times developing a healthy eating lifestyle is something that you also do as a team with everybody else in the household. In the first appointment, I do a very in-depth nutrition and lifestyle assessment to determine your specific needs. So I'm going to ask a lot of questions to get a better understanding of your daily routine. Who does the grocery shopping? Who does the meal planning? What weight loss methods have you tried in the past? What tools have worked for you in the past? And I take all of that information into account before developing the plan. All right, so now I want to change the slide here. Hopefully I'm able to do it because my view is a little different. Let me know if you can see my second slide again. Oh, okay, gotcha. All right. So individual during the individual nutrition weight loss counseling, I also provide exercise guidance. I'm not an exercise physiologist, so I can't give you an actual routine that you can follow, but I am able to provide guidance. So based on your current physical activity level, I can give you advice on whether or not it needs to be increased, or if the type of physical activity needs to change in order to better meet your needs. So that is part of the session. I also provide recipe cards. We have a whole wall with, I think, 50 plus recipes there already of a variety of healthy recipes. I try to put we do one new healthy recipe every single month that we put into the wall. So anybody that comes to see me, I encourage them to at least take one of each. So that's a great resource. Here you can see here in the slide an example of one of the healthy recipes that we did recently. And I provide practical tips and strategies to make healthy eating a reality. I think this is the part that my patients value the most during the sessions, is we really talk about how to make meal planning a reality, because we all know that we should meal plan, but what steps do we need to take to actually make that a reality? And we include that into the goal setting. We talk about portion control. What are the right portions for your particular needs of the different food groups? Not just for weight loss, but to make sure that you're getting proper nutrition, right? We talk about coping with stress and emotional eating, because that is something that a lot of my patients struggle with, and we talk about tips and strategies to combat that. And we talk about how to eat out, be able to eat out and still maintain a healthy lifestyle, because my philosophy, I'm very realistic, and I understand that eating out is going to happen, especially in the type of environment that we live in. Eating out is part of what we do. And it's a time where we socialize with friends and family. So I want my patients to feel extremely confident when they go to the restaurants or even a fast food place. I want them to feel confident as to what is the choice that I can make here that's going to help me stay on track with my healthy eating lifestyle. And I talk about topics such as managing hunger and appetite. Sometimes patients feel hungry throughout the day because they're not getting proper nutrition. Even though patients may be getting an excess amount of calories in their diet, they may not be actually getting proper amounts of good quality protein or healthy fats to help you keep you satisfied, or even the time set of day that you have your meals can have an effect on your hunger and appetite. So those are things that we also address during our sessions. And then at the end, we do very individualized goal setting. So when I say individualized, I mean that this goal setting is really specific to the patient, to what my patient's needs are. And I take into account what is my patient ready to change right now. So the goal setting is not something that I impose on my patient. This is the teamwork. We decide together what are those goals that you feel ready to start working on, and we take it one step at a time. I see patients in different locations. I see them in Gainesville, in our Lanier Park campus. I see patients in Braselton, in the building called Medical Plaza 1. And I also provide telehealth visits, which has been it's gone very successful so far. I have a good amount of patients that have done telehealth and are doing really, really well with their lifestyle changes. And I included the prices so that you are aware that for my services, we have self-pay prices. We do not submit to insurance for my services, and the self-pay prices are $60 for the initial visit, which is an hour-long visit, and then $42 for a follow-up visit, which can be up to 45 minutes long. So that is my piece of information for you. And if you have any questions about this, then you can let us know at the end. Thank you. And I'm going to now introduce Dr. Wen. She's going to be the one that's going to continue next during the presentation. Thank you so much.
Hi, everyone. Thank you so much for joining me today during your lunch hour. My name is Christina Nguyen, and I am a board certified obesity medicine and family medicine specialist. And I'm very passionate and excited about this field of obesity medicine. And I'm hoping that after today's talk that we can help many patients with their weight loss struggles. So let me give you a little piece of background of obesity. So, oops, so sorry. Let me see how I can. Give me just a second, guys. I'm so sorry. I'm unable to forward my screen.
Let's see.
There we go. Okay. All right. Thank you.
Sure.
So just to let you know of some obesity statistics, there's actually 650 million people globally that live with obesity. And when you take a look at the US, there's 93 million people with obesity. Going down to the state of Georgia, 3.4 million people. And locally in Hall County, over 65,000 people living with obesity. And when you equate that into a stat, it's actually 1 out of every 3 people are living with obesity. So what causes obesity? It's actually a true chronic disease, and we know that it's multifactorial, so it's not just one thing. You could actually have as a genetic disorder. It's very rare, so we don't see that a lot, but there's something called epigenetics, and certain environmental factors can actually turn on and off certain genes that help you lose weight or gain weight. Medications is another reason that you can gain weight, especially with beta blockers for your hypertension, steroids, and insulin. And a lot of psychiatric meds can do it as well. Environmentally, there's food abundance now that we're not hunters and gatherers anymore. The portions are bigger than they were before in the past. And it seems like unhealthy foods are less expensive than healthy foods. Behavioral wise, having a lack of sleep can actually cause you to gain weight because there's a certain hormone called leptin, that's the fullness hormone, that decreases when you don't get enough sleep. And also being under a lot of chronic stress can increase the release of cortisol, and that actually makes you crave for carbs and sugars. So a lot of things that can cause it. This is a quick slide to show you so that you'll understand the medications when we get to it, but it's the physiology of eating. And it's actually it's actually very well orchestrated. There's one hunger hormone called ghrelin, and that's actually released from the stomach. And there's also a slew of peripherally secreted hormones from the intestines, from the pancreas, and adipose tissue. Some examples are CCK, GLP-1, leptin. And these hormones actually get released, go to the brain, to something called the hypothalamus, and that's the center of hunger and fullness. And it actually tells us, when we need to eat and when we need to stop. So how does obesity impact your health? We know that when you gain that excess body weight, a lot of other medical problems can arise. So it can affect you neurologically, cardiovascularly, the pulmonary system, the GI system, the GU system, the endocrine system. It actually is linked to 13 types of cancer, and definitely our musculoskeletal system, excuse me. So if we treat the root cause, which is that excess weight, we can actually improve your health and improve these comorbidities. So how much weight is beneficial? You actually don't have to lose an abundance amount of weight for it to impact your health positively. So studies have shown that just a weight loss of 5 to 10% is actually very clinically meaningful. So if you're pre-diabetic, for every kilogram of weight that you lose, you actually reduce your risk of progressing to diabetes by 16%. So that's pretty significant. If you're diabetic, for every 2 pounds that you lose, you actually reduce your A1C by 1/10 of a point, and that's really significant as well. You can decrease your blood pressure by 5 millimeters of mercury. You increase your good cholesterol. You decrease your triglycerides. And for the joints, for every pound of weight that you lose, there's actually a 4-fold reduction in the load on the knee. So it's a pretty significant thing. So what we're trying to say is that you don't have to get below a BMI of 25 to be healthy. You can actually still be healthy at a reduced weight. So some of the things that we use to diagnose your obesity and actually to follow the progress of you losing weight is your BMI, your waist circumference, and your body fat. the BMI is your weight in kilograms over your height in meters squared. But just wanted to point out that compared to the general population, unfortunately, Asians actually carry more body fat at a lower weight. So when you get categorized for being overweight, you actually is 23 for Asians and 25 for the general population. And then to be in the obesity category, Asians are considered obese at a BMI of 25, as opposed to the general population was 30. Same thing for waist circumference. When we gain weight, a lot of us gain weight in the abdominal area, and having that visceral fat, which is the fat around your organs in the abdominal cavity, is actually very, very dangerous. It does increase your risk of having cardiovascular disease, diabetes, and cancer. So we use it to measure to see as you're losing weight to make sure that your waist circumference is going down. And then body fat, we're hoping to get a body composition scale that can calculate that for you. But these are all the things that we use to diagnose you and to measure your progress. So the BMI criteria to get prescribed weight loss medications is to have a body mass index of greater than 30, or to have a BMI of greater than or equal to 27 with one weight-related medical problem. But I just wanted to point out that despite being on medications, you see the foundation that you actually have to have good nutrition, increased activity, and making behavioral changes for this to work. You can't just depend on the medications alone. So which type of patient should see an obesity medicine specialist? So we have anyone that is interested in medical weight loss, who struggled and have tried everything. We have patients who qualify for bariatric surgery, but they're really not ready to fully commit yet, but still want to lose weight. We have patients who are in the bariatric surgery program and they're preparing to have bariatric surgery and need to lose weight preoperatively. And we have patients who have regained weight after having bariatric surgery. And we've been able to help a lot of those patients. And then any patients that need weight loss before having joint replacement surgery, permanent surgery, or reflux surgery, because it actually does decrease your post-op complications, as well as preventing you from having those issues again. And one thing that we're actually very proud of in our program is that we do see adolescents. So any patients 12 years and up, we are able to treat for weight loss. And if they are below 12, sometimes we do a case-by-case basis, but that would have to be discussed with the individual providers. So this is the last slide before I talk about the medications, because I know I've been waiting to hear about that. But there's a study that was done in 2019, and it actually obtained records from the pharmacy and from the EMR of 8 healthcare systems in 8 different regions. And when they looked into it, they actually saw that there's 2.2 million patients that were eligible for the weight loss medications. And unfortunately, only less than 30,000 of those patients, less than 30,000 patients actually got a prescription. So that means that only 1% of the people who are eligible actually got a medication to treat their disease. So there's 99% of the patients out there who could use our help but are not getting it. All right, so now we're talking about the things that you've been waiting to hear about. So we have the anti-obesity medications. There's actually 5 FDA medications that's approved for long-term treatment of obesity. And the first 3 are pills. The 4th one is an injection. And then the 5th one is actually a pill, but they call it a device. But I'll explain that in the later slides. But just to let you know that medications give us about 5 to 10% of our total body weight loss, meaning that if your weight is 200 pounds, you'll get anywhere from 10 to 20 pound weight loss. And some patients who are super responders and do really well with nutrition and exercise, they actually can lose more, but normally the 5 to 10%. And also, whenever you're on these medications, especially women of childbearing ages, we want to make sure that you're on birth control, because we definitely don't want you to lose weight if you're pregnant. All right, so we will start talking about the medications. So the first one is something called Xenocal. There's an over-the-counter version called Ally, and it is what we call a lipase inhibitor. So it blocks about 30% of all the fats that you consume in your diet. And the way that is excreted is through the stools. So you end up getting oily stools in the toilet. You actually go to the bathroom more than usual. When you pass gas, you pass other stuff. And sometimes it just kind of comes on its own. So it is probably not the best one that is out there. It's something that we actually have to just talk about and then kind of move on, because it really does not give a lot of weight loss, and the GI side effects are pretty horrendous. It does interfere with absorption of fat soluble vitamins, so you have to take a multivitamin every day. You definitely don't want to take it if you're pregnant or breastfeeding, if you have malabsorption states. So patients who've had gastric bypass surgery, we definitely don't want to use this in them, and cholestasis. But this is one of the medications that's actually FDA approved for children equal to or greater than 12 years old. The next medication is something called Contrave, and it's actually a combination pill of made up of naltrexone and bupropion. And bupropion, if you've heard of it, it's Wellbutrin. It is an antidepressant. It's actually an inhibitor of reuptake of norepinephrine and dopamine. It actually is also used for smoking cessation. So we know that it works in the craving centers of the brain. The naltrexone component is what we call an opioid antagonist. And we actually use this medication for patients who want to get off alcohol or who are trying to get off of their chronic pain meds. So when you use them separately, you really don't get a lot of weight loss or no weight loss at all. But when you combine them together, it actually works great for weight loss. It ends up making you feel fuller quicker, fuller longer, and cravings actually decrease quite a bit. But some of the side effects that the bupropion can cause a little bit of a headache and elevated blood pressure. So we have our patients keep a log of their blood pressure during that first week. Sometimes you can get that nervous jitteriness. And for the naltrexone, you can have nausea with it, but if you eat some protein, it should go away. Contraindications, once again, pregnancy and breastfeeding, seizures, because the bupropion component, the Wellbutrin, actually lowers your seizure threshold. You can have seizures. You don't want to use it with patients on chronic opioids if that's what they're using to treat their pain, because the naltrexone part actually cancels out any pain control of the medications. And we always are advocates for patients. So these medications sometimes are not covered by insurance. So we always try to give a generic equivalent to it. And so if we had to, which would make it a whole lot cheaper, we will break it up into 2 prescriptions, giving you bupropion and naltrexone separately, and those are the starting doses. The next medication is something called Kusemia. It's a combination of phentermine and topiramate. And phentermine is a sympathomimetic, meaning that it's a medication that can cause your blood pressure to rise or your heart rate to go up. So it's scheduled for controlled substance. So it's lower on the tiers, not as habit forming, actually not habit forming at all, but it curbs your appetite. So it helps decreases hunger. The second part of it is topiramate or Topamax, and we use that for patients who have migraines. But one of the side effects of this medication is that it actually causes decrease in craving, especially if you have like the nighttime munchies. One of the main thing that I want to tell about this medication is that it actually can cause birth defects, the topiramate part. So we have to make sure that when patients are on this medication that they have 2 forms of birth control, and you have to document their period and a lot of times do a pregnancy test every month. The phentermine can cause palpitations and dry mouth. The dry mouth is pretty severe, so it will make you drink more water, which is not a bad thing at all. The topiramate part can actually cause tingling around your mouth or fingers, but if you put lemon in your water, that actually helps with the symptoms. It can cause drowsiness, and actually one thing that's good about the Topamax, it causes anything that's carbonated to taste very flat and metallic. So any of our patients who are soda drinkers, this would actually help them get off of that. And this medication has worked wonders in patients who have regained weight after bariatric surgery. Once again, we do have a generic equivalent of it, and we break up the prescriptions into phentermine, which is Adipex, and then Topamax. And we start off with this and we titrate up as needed. And phentermine is actually one of the FDA-approved medications to use in the pediatric population. It's for anyone that's 16 years old or equal to or greater than 16 years old. So this is actually one of the medications that gives us a lot of good weight loss for patients. Okay. The next one is something called Saxenda. And it's actually a GLP-1 receptor agonist. And the way it works is that whenever you eat food, your stomach recognizes there's food in there. And so it sends signals to the intestines. And the intestines releases this hormone called GLP-1. It goes directly to the brain, to the hypothalamus, is what we discussed earlier on. That's the center of fullness and hunger. And it actually tells you to stop eating. You end up eating a third to half of your meal. You feel full pretty much all day. And sometimes patients forget to eat. I have a few patients who have to set timers to remind themselves to eat because they're just not hungry. There is another medication called Victozin. You guys may have heard of it. It's the exact same molecule as Saxenda, but it's used to treat diabetes. And so that's why this is the type of medication that if you're diabetic or pre-diabetic, we'd like to use this for you. And you start off at, it comes in a pre-filled pen, you start off at a lower dose, 0.6 milligrams. And then every 7 days, you can increase it by 0.6 until you reach 3 milligrams per day. The drug company tells you to, go ahead and just increase it every 7 days. But I tell my patients, if you're losing weight on a lower dose, you can stay on it for longer. There's no need to increase it that rapidly. One important thing is that you actually have to ask all patients, if they have ever had a personal history or family history of something called medullary thyroid cancer or MEN type 2, and that's multiple endocrine neoplasia type 2. Because in studies, when they did this Saxenda, they actually found that these two types of cancers were found in lab rats. But the thyroid gland of a lab rat is completely different from a thyroid gland of a human being. And since this medication has been out since 2014, there has been no reported cases of these cancers in humans. And this is like the newest medication that is used, or it was approved for adolescents. It just got approved in December of 2020 for kids greater than or equal to 12 years old. And it's also very, very good for patients who have regained weight after their bariatric surgery. The next medication, and it's actually not called a medication, it's called Plenity, and this is the newest thing out here for weight loss. It's actually made up of a super absorbent hydrogel made of cellulose and citric acid, and it comes in capsules. So you take 3 capsules with lunch, 3 capsules with dinner, and you drink 16 ounces of water with it. And when the capsules disperse, you have these tiny little particles that absorb about 100 times its weight in water. So it takes up volume in your stomach. And usually a stomach is about 1 liter. So it takes up about 250 mils, which is a quarter of your stomach, and makes you feel full. When you first take it, it does take time to kind of transit through your system. So during that first week, you can gain anywhere from 1 to 5 pounds, and that is expected, and that's a normal thing. After that, you'll start seeing weight loss. But the different thing about this is that the BMI treatment starts at a BMI of 25. As we had spoke earlier, usually for medications, it's either a BMI of greater than 27 with one comorbidity or a BMI of greater than 30, but this lets you treat patients with a BMI of 25. Some of the side effects you can have, bloating. Some people actually end up having constipation. Some people have diarrhea, but it does kind of interfere with your bowels during the first few weeks. It is not covered by insurance, so it is kind of pricey, about $98 a month. And the reason why it's considered a device is because it does not get absorbed in the body. So when it goes through your system, when it gets to the intestines, all the water is reabsorbed back and it mixes with your stools, and it just doesn't get into your system. Right now, it's not widely available, and there are 3 obesity medicine specialists within the network that can prescribe it. So it's very limited, but we've had some good successes with it. So those are the 5 medications that we have to offer patients. And there is one last one I actually want to talk about that just came out. It actually is called Ozempic. It's actually right now, it is used to treat diabetes at the max dose of 1 milligram weekly, but they've done studies and they just published that in February, that they have an Ozempic 2.4 milligrams that have been given to patients, and we combine it with a healthy diet and behavioral modifications and increase in physical activity, you actually get a 16% total body weight loss, which is phenomenal, because we had discussed before that most medications give you 5 to 10%. So they have submitted this for FDA approval. So usually it takes a very long time. And because of the COVID thing right now, this is kind of stalled, but it's something that we may be able to offer to our patients in the future. And we're hoping maybe mid-year that it might be available. So we have the obesity medicine specialists taking care of the medicine side, but we also have other people in our teams, our experts, that help with it too. So to treat this disease of obesity, you actually have to have you treat everything else. So we have in our program Jennifer Way and Charlotte Hill, and then from the systems level, you just saw Giselle talk about do her talk today. So these are the three dietitians that we use, and they are fantastic. These ladies know exactly what they do. They custom tailor your plan to how you eat and what your lifestyle is. And they actually treat both adults and children as well too. And then, of course, we have Mr. Aaron Perez, who is phenomenal. He is our behavioral health specialist, and he specializes in behavioral modifications for weight loss. And he gives you excellent tips and strategies on how to kind of rethink the way you eat. Okay. One of the resources that we get from a systems level when you're an obesity medicine specialist is all these things I want to talk about. There's actually something called the Berry Boutique, and it's a great concept. You actually can donate gently used or new clothing to this boutique. And as you're losing weight, you can actually go in and find the clothes that fits you. And once they don't fit anymore, you can bring them back and let someone else use it. So that way you're not having to buy a new wardrobe with each significant weight loss. There's a bariatric cooking class, which Giselle, our registered dietitian, runs. She actually is a classically trained chef as well as a dietitian, so she's a pretty talented lady. And there's weightlifting classes and yoga classes you can do, and these are all streamed, so you can do it virtually at home, but you can do these classes at any fitness level. The instructor's pretty good about including everyone. So to conclude, just let you know, our program is evidence-based medicine. So everything that we do is backed up by studies. So it's not something that we make up or something that we feel we're the expert in our clinic. We know we have to do it with a comprehensive treatment team as well. We know that it's a multimodal treatment, meaning that it's not just medications alone. You have to have good nutrition, you have to increase your physical activity, and you actually have to change your behaviors. The medications are tailored to the patient's medical condition, their insurance coverage, and their preference. So we always include the patient in making decisions on their treatment plan. And we know that obesity is a chronic disease, so you have to treat this long term. It can't be sporadic, 3 months at a time, stop, start again. It has to be long term. And we always have close and continuous follow-up with our patients. We set realistic goals and expectations. And in the end, we are on their side, and we want them to do the best that they can. So that concludes my presentations. I will turn this back to Amy. Trying to figure out how to do this. Stop sharing.
Thank you so much, Dr. Nguyen. That was wonderful. I had a lot of great comments from those that are watching. So this is a picture of all 9 of our providers within our program that are obesity medicine specialists. And so we have a wonderful team of well-trained folks who specialize in medical weight loss. And then also, I wanted to show you how to get started with us. And so the first thing I would recommend is our phone number here, 770-219-0446 is our office number. So that's a number that you can call, get your questions answered. And if you're interested in treatment with any of our treatment options, we can guide you there. We also have a website at nghs.com/bariatric. We do have an online seminar that is available there if you're interested in the surgical route. But specifically for obesity medicine or medical weight loss, I wanted to share that we do have several options for locations for treatment. That's in the Gainesville, Brazelton, Chestnut Mountain, Flowery Branch, and Thompson Bridge locations.